Healthcare professionals from the public and private sectors were on Wednesday informed about the country's readiness for the novel coronavirus and the integral role they play in the fight against the disease at the launch of the first ever coronavirus symposium held at the National Cultural Center. Later that evening, Guyana confirmed its first case of COVID-19. Minister of Public Health, in her address to stakeholders of the medical fraternity, highlighted that the task of ensuring the safety and protection of the Guyanese people requires a multi-sectoral approach.
It is evident that this task cannot be singularly managed by the Ministry of Public Health, and we don't claim to be any hero. And so I'm calling on all stakeholders, the private sector, the government, the other government ministries and all agencies, NGOs, as well as all our citizens resident in Guyana, to demonstrate the will and national spirit so that our mobilization against COVID-19 is a concerted and collective effort. I therefore wish to charge all of you to be responsible and not to take COVID-19 lightly.
Lawrence reiterated that all differences should be set aside in dealing with the dreadful disease.
It would certainly be tragic if we allow petty differences to distance us from pooling our efforts in the face of this critical global health challenge. COVID-19 is a real threat. It's not an issue that will disappear at a flash. However, we have the evidence that COVID-19 is on the rampage.
Port health officers, according to the Deputy Chief Medical Officer, Dr. Karen Boyle, have developed new screening tools to assist in the assessment of travelers. Expounding on the screening process at the ports of entry, Dr. Boyle said persons who do not show symptoms of the virus but travel to one of the high-risk areas in the last 6 weeks are allowed entry to Guyana but are subject to follow-ups from health ministry officials. Boyle explained the difference between quarantine and isolation for the purpose of monitoring COVID-19.
Quarantine is usually a type of isolation, but it's used for persons who do not have symptoms but may be at risk. And the isolation is for persons who are ill, who have symptoms, and to make sure that they do not spread the infection to others.
Thus far, the Cheddi Jagan International Airport, along with the Georgetown Public Hospital and the Diamond Diagnostic Center, are the designated isolation areas for persons found to be showcasing symptoms. The Deputy Chief Medical Officer added that some 500 persons, all categories of staff at the ports of entry, have been sensitized on the virus and appropriate precautionary measures to be taken. The elderly are most vulnerable to the disease. There are 3 clinical criteria by which public health officials determine whether a person's illness is related to coronavirus. These include anyone with acute respiratory illness, fever, or at least one symptom of a respiratory disease, such as coughing or shortness of breath. A patient who with an acute respiratory disease and have been in contact with a confirmed or probable case in the last 14 days prior to the onset of the symptoms. Or a patient with severe acute respiratory infection and requiring hospitalization with no other causes that fully explain the clinical presentation. COVID-19 has so far affected 125 countries, with Jamaica, Guyana, Cuba, and St. Vincent and the Grenadines being the latest to confirm imported cases of coronavirus. Several countries have imposed travel bans for a number of European and Asian countries. Tamika Rodney reporting for HGP Nightly News.